Hand, foot, and mouth disease, HFMD, was first identified in 1957 in New Zealand. It's a common viral illness that primarily affects infants and young children, and it's caused by a group of enteroviruses, most commonly the Coxsackie A16 virus and enterovirus 71. HFMD is characterized by sores in the mouth and a rash on the hands and feet. While it can be uncomfortable, the disease is usually not serious and typically resolves on its own within a week or so. Hand, foot, and mouth disease, HFMD, is a contagious viral illness that primarily spreads among infants and young children through several routes. One common way the virus is transmitted is through direct contact with an infected person. This includes exposure to nasal secretions, saliva, the fluid from blisters, or stool, which is particularly prevalent in household or daycare environments. Additionally, airborne transmission plays a role, as the virus can spread via airborne droplets when an infected person coughs or sneezes. The disease can also be contracted through contact with objects or surfaces contaminated with the virus. Children are particularly at risk as they often touch various surfaces and then put their hands near their mouth, nose, or eyes. Moreover, the fecal-oral route is a notable path of infection, especially among children who have not fully developed toilet habits. The virus can be present in the stool of an infected person, and inadequate hand hygiene after using the bathroom or changing diapers can facilitate the spread of HFMD. To prevent the spread of HFMD, maintaining good hygiene is crucial. This includes regular and thorough hand washing, disinfecting contaminated surfaces, and avoiding close contact with infected individuals. These practices are essential in controlling the spread of the virus, especially in settings where young children are present. Hand, foot, and mouth disease, HFMD, typically presents a series of symptoms that are particularly noticeable in infants and young children. The illness often begins with a mild fever, which is usually one of the first signs that a child is affected. Accompanying the fever, many children experience a sore throat, which can be painful and contribute to a general feeling of discomfort. One of the hallmark symptoms of HFMD is the appearance of painful mouth sores. These sores start as small red spots, mostly in the back of the mouth, and can develop into blisters or ulcers. These sores are often a significant source of discomfort for children, making eating and drinking challenging. In addition to the sores in the mouth, HFMD is characterized by a distinctive rash on the hands and feet. This rash can consist of flat or raised red spots, and it may also include blisters. The rash is a key identifying feature of the disease. Children with HFMD might also show signs of loss of appetite and increased irritability, primarily due to the discomfort caused by the mouth sores and sore throat. Furthermore, they often exhibit general malaise and may appear more lethargic than usual. The progression of these symptoms usually occurs in stages, not all at once, and while HFMD is generally a mild disease that resolves on its own within about a week, the symptoms, particularly the mouth sores and rash, can cause considerable discomfort. It's crucial to monitor fluid intake to avoid dehydration, especially in cases where children are reluctant to eat or drink. In instances of severe symptoms or if there are any concerns regarding a child's health, seeking advice from a healthcare professional is recommended. Hand, foot, and mouth disease, HFMD, typically requires supportive care to manage symptoms and ensure comfort, especially in children, as it is usually a mild viral illness that resolves on its own. Key aspects of treatment and management include maintaining hydration, which is crucial. Encouraging the intake of plenty of fluids, such as cold milk products, can be soothing. However, it's important to avoid acidic or spicy beverages that might irritate mouth sores. Pain relief is another important aspect of treatment. Over-the-counter medications like ibuprofen or acetaminophen can help in reducing fever and relieving discomfort. For children and teenagers, it is essential to avoid aspirin due to the risk of Reye's syndrome. Additionally, mouthwashes or sprays specifically designed to numb mouth pain can be beneficial. If choosing such products for young children, it's important to select ones that are safe if swallowed. Applying topical ointments on skin rashes and blisters can also provide relief. These should be soothing and not too harsh on the skin. Along with this, ensuring adequate rest supports the body's recovery process. Eating soft, cool foods can be easier, especially when dealing with painful mouth sores. Options like ice cream, yogurt, or chilled soups might be more comfortable. Maintaining good oral hygiene with gentle brushing of teeth and gums can help in preventing secondary infections. Avoiding irritants, such as salty, spicy, or acidic foods, is also advisable to reduce irritation to mouth sores. In addition to these measures, it's crucial to practice good hygiene to prevent the spread of HFMD. This includes frequent hand washing, disinfecting frequently touched surfaces, and avoiding close contact with those who are infected. If the symptoms of HFMD are severe, if a high fever persists, or if there are signs of complications like dehydration, it's important to seek medical attention. In rare instances, HFMD can lead to more serious conditions, and a healthcare professional can provide necessary guidance and treatment.